We are watching her.
Have you ever wondered why you have to get your blood drawn? How about how it's done? Well, today I'm going to be telling you why it's important to get your blood drawn and show you the equipment used. My job is a phlebotomist at a hospital, so I go around and I draw people's blood every day. Everyone has or eventually will have had their blood drawn. Being able to understand why it's important will hopefully make it an easier time the next time you have to get it done and have you appreciate it more. Today I will be going over the importance of it and the equipment used and some of the steps taken. First, I'm going to explain why it's important to get your blood drawn. Blood draws give healthcare providers a glimpse into the inner workings of your body. It holds tons of information about your health and can help healthcare providers make a personalized treatment specific for your needs based on your blood profile. It can also help with preventative medicine by regular blood screenings. Can help find early warning issues before they become a problem. First, now I'm going to explain some of the equipment that is used when you draw somebody's blood. So first you're gonna have your needles. There's a couple different kinds. You have your straight or vacuutators, and then you have butterflies. And they have these little wings and they look like butterflies. That's why they're called a butterfly. With the vacuutator, you got two different sizes. You got a 22 gauge and a 21 gauge. And then you got the 21 gauge for a butterfly and a 23 gauge. With the butterflies, they have a tubing that helps create less pressure when you're drawing blood, so on fragile veins, they don't blow as easily. With these ones, they got two needles. So you'll have your first needle, which is going to be what you poke the patient with. And then this one is going to be what goes into your tubes. And then this part of the needle is the sheath. So that way when you're done poking the person, that's what you cap your needle with. So that way you don't poke yourself or the patient again, because that'd be bad. Then you got your hub, which goes onto the needles. They're going to go onto this part. You're just going to screw it on. And then they are going to help you put the tubes onto the needle and then also help you stabilize the tube. After that, there's the sharps containers. So those are very important. When you are done using a needle, you want to make sure to put it in a sharps container always. They are hard plastic beds specifically meant for needles, so that way nobody will get poked by a used needle. Then we got a tourniquet. Tourniquet is what you use to wrap around your arm. Tourniquets cause the veins to swell, which makes it easier to find them, and it also helps with getting the blood. You have alcohol wipes, which is what you use to clean the area before you poke somebody, so that way none of the bad gross germs that they have on their skin gets inside. And then you got your gauze and Coban. So you're going to put your gauze over where you poke them so that way they don't bleed everywhere. And then you're going to use your Coban to wrap the gauze so that way it stays in place. We also have gloves, which are very important. They help you keep any things that you could have on your hands or anything off of the patients, and it also helps you protect anything from that's on the patient from getting onto you. You also don't want to get blood all over you either. You also have labels. Those are also very, very important. You on a label, normally you're going to have the patient's MRN or their medical record number. You're going to have their name and their date of birth. And then you are also, once you're done, going to put the time and date of the draw as well as some identification showing that you were the one who drew it. And then usually they also have a tracking number for the tube and the tests that are being ran on that tube. Now I'm going to explain the tubes. So there's quite a few different kinds of tubes. So with the tubes, they all each have a specific additive in them that help you run and perform specific tests. The additives and so the order of draw is very important. because you don't want the additives from the previous ones to get in to other ones because it can mess up your results. So for the order of draw, you're first going to do cultures. I don't have that on here because it's a whole new thing that we're not going to talk about today. And then you're going to have your blue, which has sodium citrate in it for its additive. And then you got your red or your no SST, and it has a clot activator. And you got a gold or an SST, which is a gel clot activator. And the SST stands for serum separator. And so the red's called a no SST because it doesn't have the serum separator. Then you have your greens. You got your green, normal green, which is a lithium heparin, and the dark green is also a lithium heparin. It just doesn't have the gel like the other one. And then your lavender and your pink both have EDTA. Your pink is just bigger. And then you got the gray, which is sodium fluoride. And then after that, you would have any specialty tubes that would come after. Today we talked about why blood draws are so important in healthcare. We talked about how important the steps are in making sure results are accurate and patients stay safe, from labeling tubes to handling samples carefully and properly. Thank you for listening, and I hope this gave you a better understanding on why blood draws are so important for the quality of patient care and a new appreciation for them.